All right, good evening, good evening. I am Dr. Kimberly Smith-Dotrieve, and I will be your presenter tonight. Thank you all for sharing your time with us this evening. Hopefully you find this information quite interesting. Tonight, I am talking about sleep apnea and pulmonary artery hypertension, and can CBD help with these issues? So first off, we want to talk about sleep apnea. I'm pretty sure everybody has heard about sleep apnea. I'm sure at least one person in your family has it. It's pretty common. It is one of the most common sleep-related disorders that we know of today, but still one of the most underdiagnosed disorders that we have. And it's a bad thing because there's so many complications that can occur as a result of sleep apnea that everybody needs to be more aware of it, and more people need to be tested. The biggest thing that I hear about sleep apnea is, I don't want to wear that mask. And hopefully by the time I finish giving you all the information about this disease process, you will understand better the reason why you need to know if you have it, and the reason why you really need to have it treated if you do have it. So what causes sleep apnea? What's happening is you're having a collapse of the upper airway. How can that happen? Well, number one, people who have horrible sinuses and are nose breathers. So they're sleeping, they're breathing through their nose, and their nose is significantly congested. So because there's so much congestion and swelling of the mucosa, it's hard for them to get the air through there. Another thing that could happen, some people can have very large turbinates within their nostrils, or they can have large adenoids and tonsils. Of course, having the tonsils removed and the adenoids removed can be helpful. There are some people who have really, really large necks. And I know you've seen these people as well. And that large neck can cause an issue if that person is lying on their back sleeping, because all of the extra tissue here becomes obstructive when those muscles relax when they're in their deep sleep. So those are just a few things that can actually cause a collapse of the upper airway. Sleep apnea is more common in men than women. 30% of the population are men who have sleep apnea, about 15% are women. How do we know if we have sleep apnea or not? A sleep study. And so a sleep study before, I would say about 5 years ago, before 5 years ago, you used to have to go to the sleep lab in order to have a sleep study done. Now with technology, we have home sleep tests. So it's made it more easily done by everybody, which is another reason why we shouldn't put it off, and we shouldn't be afraid to have it done. You don't have to go to the sleep lab anymore. But when a sleep study is done, we're able to follow the oxygen level and your heart rate, and we're able to detect whether or not you slow down your breathing enough that your oxygen drops, or if you have actual episodes where you just stop breathing completely for some period of time. That is the significance of the sleep study. And when that sleep study is done, we're looking for the number of times you actually stop breathing, and the number of times your oxygen level just drops as a result of you breathing more shallowly. And we get a number or ratio called the Apnea Hypopnea Index, or AHI, to be just kind of short and sweet about it. So when we look at the AHI, normal should be less than 5. Anybody who has a ratio that is above 5 has a diagnosis of sleep apnea. And it can be divided in mild, moderate, and severe, with 5 to 15 being mild, 16 to 30 being moderate, and anything over 30 being severe. So when we think about sleep apnea, what signs and symptoms should you be looking for? Well, mainly people will first complain about daytime sleepiness or fatigue. These are people who they might be at a stop sign or a red light and they can fall asleep at the wheel. These are people who eat their lunch, and while they're finishing up their lunch, oh, they're falling asleep. You might be having a conversation with them and they are literally falling asleep right before your eyes. These are folks who, if just left to themselves in the quiet, they'll easily fall asleep. People who take long car rides and they can just go to sleep instantly. These are just different scenarios that if that is happening to you, you may want to get some testing done to see if you have sleep apnea or not. Loved ones, family members will complain about loud snoring. And every time I ask this question, patients typically will say, oh, I don't snore. Well, it's kind of difficult for you to know if you're snoring if you're sleeping. Now, when it's really bad, many people who have sleep apnea will wake themselves up with their snoring because they're not in a deep sleep at all. They're in such a light stage of sleep that they can hear themselves snoring. Waking up multiple times throughout the night. Now, you know, there could be other things going on, like diabetics potentially might be getting up to go to the bathroom a lot. But for the most part, if you're just waking up multiple times throughout the night for no real reason, then it might be because you have sleep apnea. Because what is happening is, as you get into your deep sleep, your oxygen level is dropping. And when it gets to that critically low level, your brain, like, all right, chick, wake up. You need to get up, because your brain senses that your oxygen level is too low and will pull you from that deep sleep to one of the second or third phases of sleep where you're more aware. And it's during that time that you realize, oh, I'm hot, I'm cold, oh, I need to go to the bathroom. And that'll get you up and make you go to the bathroom. Just to put it out there, most people, your bladder should have the capacity to hold your urine throughout the night. And if you're having to wake up multiple times, unless you are a diabetic or somebody who has a prostate issue, if your bladder is fine and your kidneys are functioning well, then you should be able to go the whole night without having to wake up to go to the bathroom. Light sleepers. I have people tell me that all the time. Oh, I'm just a light sleeper. If you are in your REM sleep, and REM sleep, the deep sleep, that is when cell repair is happening. That is when your organs are recuperating. And that is a necessary cycle for you to be in, because you need cell repair and you need your organs to recuperate. But when you're a light sleeper and you wake up at the littlest sound, that means that there's something else going on that's keeping you out of your deep sleep, and you should get that checked out. Snorting during sleep, choking during sleep, and just outright pauses. And of course, the pauses, that's something that's going to be witnessed by your family members. How do we treat sleep apnea? Well, simple. We have something called a CPAP machine, which stands for continuous positive airway pressure. And with a CPAP machine, you actually have air pressure that is delivered to you when you are inhaling, so that when you inhale, you are helping your lungs to fully inflate and fully fill up with oxygen. Now, the CPAP machine is not giving you oxygen. There's not anything wrong with the way your lungs are functioning. The problem is that there is something prohibiting the full expansion of your lungs, or prohibiting the passage of oxygen to get to your lungs. But the function of your lungs is actually there. The CPAP machine, its sole purpose is to help you fully inflate your lungs, fully fill those lungs up with air, with oxygen, so that you can get the right amount of oxygen put into your blood cells. Now, the difference between a CPAP and an AutoPAP, CPAP, you have to go to the sleep lab. You put the device on, the technician is there, and when you go to sleep and your oxygen starts to fall, they are slowly increasing the pressure, and they increase it until your oxygen becomes steady, it doesn't fall anymore, and you're having a peaceful sleep. AutoPAP, on the other hand, is set between 5 and 20 normally millimeters of mercury. And the AutoPAP machine will give you what you need. If you need 6 millimeters of mercury, it'll give you that. If you need 12 millimeters, it'll give you that. And that need might change maybe month to month if you're gaining weight or losing weight, if you're having sinus symptoms or not. Different things can make that change. But I definitely am a fan of the AutoPAP because it keeps the patient from having to go back to the in-house lab to have that CPAP retitrated or weaned to a higher or a lower pressure. It'll give you exactly what you need. Now, other things that you can use when it comes to treatment for sleep apnea is there's an oral device that a dentist can make. And these oral devices, unfortunately, people like them because they don't have to wear a CPAP. But the problem is, every single patient I've ever had who has spent about $1,500 having a dentist make the oral device, and the purpose is to keep the airway open. Like I said, some people have a thicker neck, their tongue, even though, you know, it's a myth, you can't swallow your tongue, but your tongue, it can be in the way, and it can lie at the back of your throat, and it can prevent the air from passing through. So the oral device helps to keep your tongue flat, and it keeps it kind of plastered down to the bottom of the mouth so that it cannot get into the way, so the air can pass through the way it needs to pass through. But again, of all the people I have had who have had that device made for about $1,500, not a single one of them has worked. So do not waste your money on that. And if you have an oral device already and you have not been retested, you need to be retested so that you can see whether or not it's working. The latest thing actually is the Inspire device. So the Inspire device is something that's actually implanted within the body, and it provides an electrical stimulus to the hypoglossal nerve, and it's supposed to provoke your ability to breathe deeply when you're sleeping. It's new. I'm not quite sold on it yet. I have only one patient who's just insisted on having it, and it's actually an alternative to the machine or the AutoPAP machine. So if you're somebody who's just like, nope, I don't like that machine, I can't stand it, then maybe that Inspire device is something that you might want to look into. Otherwise, I do highly recommend that you just get to a point where you can tolerate your machine. The main thing about the machine is making sure you have the right mask. Most people say it's uncomfortable. There are several reasons why it might be uncomfortable. You might not have the right mask size. You may need to adjust the humidifier. You might even need to adjust the temperature. There are different things that you can do to try to make it more tolerable. Last thing on here is the airway surgery. Again, getting your tonsils and adenoids taken out. Some people actually have their palate reconstructed. And those are major things that people have done to get this. But even sinus surgery, rhinoplasty, sometimes they have to just straighten out their nasal septum. Again, those are viable things, and seeing an ENT will help you to know whether or not these are things that need to be done. But ultimately, the CPAP or the AutoPAP will be the answer. Complications that can occur as a result of untreated sleep apnea. So remember this, the whole thing about sleep apnea, the whole disease process is when you get to your deep sleep, your breathing happens more shallowly. You might have such a great relaxation of the neck muscles that is starting to obstruct the flow of the oxygen, or you might have such nasal congestion that is obstructing the flow of oxygen through the nasal passage. But all in all, the end result is that your oxygen level is dropping. And I have seen it so bad that the oxygen level has been down to a 50. Normal oxygenation should be 95% or higher. So if you're below that, you definitely need to be checked out. And this is during sleep. So one of the what is the best way to say? One of the ways that I can kind of do like a pre-test. If I have a suspicion and the patient is really like, I don't want to do a sleep study, then I do something called an overnight pulse ox. And the overnight pulse ox will give me an idea of whether or not the oxygen is dropping. If I see that the oxygen has been dropping enough times, then I'll say, okay, yeah, I have a high suspicion you might have sleep apnea. Why don't we go on ahead and just get the sleep study done? And again, you can do it at home. So you don't even have to leave your house. So if that oxygen is dropping, think about what's happening. You're having poor oxygenation of all of your organs. So your brain becomes oxygen deprived. Your heart becomes oxygen deprived. Your muscles, all of your organs are becoming oxygen deprived, which means that complications can lead to more motor vehicle accidents because people are falling asleep at the wheel. It's one of the main reasons why people who have CDLs now is becoming more and more mandatory that they have a sleep study done to check to see if they have sleep apnea, because nobody wants those guys and gals driving around in those big 18-wheelers falling asleep. What else can happen? Worsening of cognitive functions. It'll accelerate memory loss, accelerate the progression of dementia and Alzheimer's. Memories, recalls, short-term memory especially, because if you think about it, your brain is tired. Throughout the night, you have this whole cycle, the roller coaster where your oxygen is high, your body starts to relax. You start to go through the different phases of sleep until you get to your deep sleep, the REM sleep, and then your oxygen starts to drop. When your oxygen gets to a critically low level, your brain's like, all right, wake up, wake up, wake up. Your brain wakes you up enough, pulls you into phase 2 and 3, where you're more aware, but it makes you take a deep breath. It'll make you turn over, all the, the hot and cold, but mainly you're awake enough that you can deep breath in, get your oxygen level back up. And when your oxygen level has been up, now your body starts to relax again. You get to your deep sleep, your oxygen drops again, and brain wakes you up again. So you're waking, falling asleep and waking, falling asleep and waking throughout the night. This can happen. I've seen it hundreds of times on sleep studies where a patient's oxygen drops and comes back up. So your brain has not had a nice long run in its REM state, in that REM sleep where it's able to recuperate, where it's able to have cell repair happen. So when you get up the next day, you're still tired, number one, but your brain has a battle going on now. Part of the brain knows I have work to do. I need to get up, I need to get moving, I have tasks, I have things to complete. But the minute you get to a point where there's a lull, that other side of the brain that's just tired starts to take over. And so you're in a meeting, your boss is talking to you, and your brain is tired and it's starting to shut down. So you're listening, but you're really not listening. Your eyes are open, you're hearing words, but you're not comprehending. So many times you're involved in conversations, but you're really not hearing the conversation. And that's why a lot of people think that they have memory loss. And it's not that you have memory loss, is that you did not hear the conversation in the first place because you were too tired. So cognitive deficits, increased cardiovascular events. If you know anybody who had sudden death before the age of 50, I guarantee you 95% of those folks had undiagnosed or untreated sleep apnea. So if you think about that oxygen dropping, when we think about heart attacks and strokes, we always think about it from the perspective of blockage. So you have enough blockage, it prevents the blood from flowing to those tissue areas, and blood is carrying the oxygen. So in the case of sleep apnea, your blood vessels might be completely open, or you might have minimal blockage. But when you get to your deep sleep and that oxygen is dropping down to the 70s or 60s or 50s, you're creating the same environment that would have been created had you had 70–80% blockage. So heart attacks and strokes can happen. Again, if you know somebody under the age of 50 who suffered any kind of heart attack or stroke, if they survive, you need to have them, tell them they need to get checked for sleep apnea. Pulmonary hypertension. So the way our system works, our blood comes in from the lower and upper part of the body on the right side. It goes into the right part of the heart, the right atrium first, down to the right ventricle. Then it goes through the pulmonary artery into the lungs, where it gets oxygen. So carbon dioxide gets off, oxygen gets on. And from there it goes to the left side of the heart. Well, when you have sleep apnea, there is a lot of tension, a lot of oxidative stress that starts to happen within the lungs. And it's causing a whole lot of inflammation to happen within that pulmonary artery. And that is where the pulmonary hypertension comes from. You get proliferation of the smooth muscles, you get the oxidative stress. That lack of oxygen puts a lot of inflammation on the pulmonary artery. And so when that happens, the pressure within that artery starts to increase. And when that pressure starts to increase, it makes it difficult for the right part of the right ventricle to easily push the blood through that artery. So what is happening at that point is you're creating a traffic jam. If the right ventricle can't push the blood through that pulmonary artery, the blood that's coming into the right atrium can't get to the right ventricle. The blood that's coming in from the rest of the body can't push through. And that is where you see the swelling in the legs. That's when you see people who have a whole lot of edema going on. And edema is not the only cause of edema. Edema can be from other things as well. But if you have edema, if you have swelling in your legs, especially swelling where if you press your finger down and hold it there for about 5 seconds, if it leaves an indentation, that's significant swelling. We call that pitting edema. You definitely need to get your heart checked out. So whenever there's pulmonary artery hypertension, that can lead to heart failure on the right side of the heart. And that heart failure in turn leads to that swelling. And other things like metabolic syndrome and diabetes can happen as a result of untreated sleep apnea, and non-alcoholic steatosis, which is the fatty liver, which everybody on here, I hope you've all had your bioscan done, and that's exactly where you would have heard of a fatty liver. So all of these issues can happen as a result of untreated sleep apnea. Now, the pulmonary hypertension itself, different categories have been given, but it's just the elevated pressure in the pulmonary artery. But pulmonary hypertension is the main category. But you can also have an increase in the pulmonary pressure as a result of left-sided heart failure. So if there's an issue with the left side of the heart, let's say you have the left atrium at the top and the left ventricle at the bottom. So let's say that there's a problem with the valve, and the valve is not closing completely and allowing blood to go backwards. Let's say the valve is too stiff and the blood can't get through, so the blood ends up backing up. You can have the increase in the hypertension in the pressure in the pulmonary artery as a result of left heart disease. You can also have it as a result of COPD, really bad forms of asthma, from obstruction. There could be some type of trauma that could have happened to the artery. Chest contusion is a very good example. And then there's also, of course, the unknown reasons why. Now, where does CBD fit into all of this? Remember, when that oxygen drops, it increases smooth muscle proliferation. It is increasing oxidative stress, and all of these things are leading to increased inflammation in the pulmonary artery, and it's making it harder for the right side of the heart to get the blood through that pulmonary artery into the lungs where it's going to pick up the oxygen. Well, there are studies, and I'm so sorry I'm so sorry I left out the slide that includes the study name, but I'll get it for you. But there are studies with rodents that show CBD has literally reversed pulmonary artery hypertension in rodent models. And how does it do that? It's showing that it's inhibiting that smooth muscle proliferation. It's improving the mitochondrial energy production, because we get our energy from the mitochondria, and our ability to do the different activities that we're able to do, which is hindered when that pulmonary hypertension happens. So it's improving the mitochondrial energy production, it's reducing oxidative stress, and it's literally shown that it improved oxygenation. So CBD continues to be the rising star in my professional opinion. I have seen still in my practice just a reversal in disease processes in patients. My one patient that I've told y'all about so many times, who she was taking 4 different medicines, and now she's only on one medicine, and she takes that one medicine only as needed still. And it's been well over 6 months. I actually talked to her today. Blood pressure is still beautiful. She still feels wonderful. And when her pressure is higher, she knows it's probably because she's had too much sodium, because, people want to binge every now and then, or it's during times when she's just not sleeping at all. So we had a conversation today, actually, because one of her family members, her pressure is still high, and she has been taking the CBD products. And what I told her was, we need to really see what her sodium intake is. You should not be taking in more than 2,500 milligrams of sodium daily. That's just a given. And so I said, so find out, how much sodium she's taking. And she's like, oh, she eats out all the time. So for me, anybody that eats out all the time, their sodium level is already going to be high. But then she goes on and she's like, oh yeah, she eats at Papados all the time. And okay, I know, I am very familiar with Papados. So for those of you who don't know this, you can Google Nutritional Facts for and put in the name of any restaurant. If it's a chain restaurant, if it's a franchise, it will pull up the menu and it'll tell you how much sodium and other things, but we're worrying about the sodium. It'll tell you how much sodium is in each menu item. So she was telling me about, what was it that she had? Actually, this was from Wendy's. It was a bacon something Southwest salad. That salad has 5,000 milligrams of sodium, y'all. 5,000. That is crazy. But you need to do your research. You need to do some, just a little bit of digging when you go to these restaurants, so that you can know what exactly it is that you're putting in your body. Now, of course, based on the Flat Belly Lifestyle Program, we do want to just give those things up, because it is much, much better for us to feed our bodies the things that are going to be beneficial, and not those things that are harmful. At least we want to be able to have most of our days where we're doing the healthy options, and have a binge every once in a while. But when we're talking about longevity, as a Christian, I believe that our days are already numbered. But I also believe that the only thing that we have charge over, the only thing that we can change, is our quality of life. So God may have us on this earth until we're in our 80s or 90s, but what kind of quality of life are you going to live? That is determined by how well we take care of our bodies. And being able to put healthy foods in our bodies is a very, very important part of this. So CBD reverses inflammation. CBD, from all the different studies that I've looked at, is protective of our muscles. Again, I think I've told you this before, but there are also studies showing that with the rodent models where CBD on board in one group, but not on board with the other group, both groups are put through heart attack and stroke simulations. And the group without the CBD on board, they suffer the typical heart and brain tissue damage that you would expect from someone who goes through a heart attack or stroke. But those who had CBD on board, their tissue function was preserved. Their cognitive function was preserved. Those are major things, major, major things. And as they start to do more human studies, you're going to see what I mean by CBD being the rising star. So now, what does Wakana have to offer? Well, first and foremost, we have the best, the most amazing products that you're ever going to come across. How do I know that? Yes, it might seem like I'm biased, but honestly, it's because I had so many patients who were unknowing to me already using CBD products when I introduced Wakana to my practice. And every single patient has been able to tell me that the difference in quality is remarkable when they switched over to the Wakana products. So we have high quality, wonderful products that are overseen by our chief medical officer, that are third party tested by a lab that specializes in hemp, located out there in Miami. So we have the reassurance that we need, that we're getting exactly what we need from the CBD products without there being any extra anything, including the 0.3% THC, which is the federally maximal limit that can be in any CBD product. To start off, let's talk about our power line here. And this gives me an opportunity to kind of go through the different product types, helping you to understand how to use them and how we put them together. So first up is our Power Hemp MD. It just happens to be our most powerful tincture. Every tincture we have, we do recommend you start off with 3 drops, drip, 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 3 drops under the tongue twice a day. When you do that, that tincture is going to peak in about an hour. You'll feel it before, but it'll reach its peak in about an hour, and it'll last for about 4 to 6 hours. The gummy, our gummies are different from other gummies because they are infused with CBD. That means every bite of CBD that you take is loaded, every bite of the gummy you take is loaded with CBD. For that reason, we recommend that you cut your gummy in 4 and start off with 1/4 of a gummy twice a day. I don't care how big you are. I don't care if you've been using the real deal for years and years and years. Please start with 1/4 of a gummy. Why do I say that? Because I've had so many big, husky, muscular men try the system. I've had millennials and Gen Zs who smoke weed all the time. And I can't take just a 4, that's not enough. And the gummy wins each and every time. So 1/4 of a gummy. It will peak in 4 hours and it will last 8 to 12 hours. Next up is our premium flower. It is the fastest way to get CBD into your system. It is part of our smokable hemp collection. 2 or 3 puffs and it will be in your system in 1 little minute. And it will last for about an hour. But when you're thinking about panic attacks, anxiety attacks, or acute pain, and you just need something to work right now, the premium flower or one of our Smokables is the way to go, or at least the way to start off. And then our Power Extreme Pain Cream, our topical cream, it's still my most wonderful, my best product. Why? Because I know undoubtedly that I can put this cream on somebody no matter where I am, and I know that they're going to have some relief within 5 to 15 minutes. And I carry this in my pocket. That is how sure I am. So every patient that comes into my office, my first question is always when I walk through the door, are you having any pain today? And if they are having pain, I let them rub the cream on the area that hurts, because I know by the time I'm done with my visit, I can tell them, all right, let's go walk to the front. Oh, by the way, how's that pain? And it's wonderful seeing their faces, the change, like, oh my God, my pain is better. So I love this product because I literally carry it wherever I go, because everywhere you go is going to have pain. And I know I can give them some pretty quick relief. So using these products, we want to do something called layering. When you think about pain, we want to use all of these products together because they have different onsets of action, different durations, and that is what you want and need so that you have consistency with your symptom relief. So if let's say you're having a gout attack, number one, you definitely want that flower right here, right now, to help take the edge off. But you also want to rub the pain cream on, and you want to put those 3 drops of the tincture under your tongue and take a 1/4 of that gummy. So what is happening with all of this? I know in 1 minute that flower is going to start working to take the edge off of the pain. I know that in 5 to 15 minutes, that pain cream is going to be joining it to further take down that pain. Now, that flower is going to be wearing off in an hour. Well, in an hour, I know that tincture is going to be peaking. And when that tincture is going to wear off in 4 hours, I know that the gummy is going to be peaking. So when you do this twice a day, you have a steady relief and the best chance of the best steady state of relief that you can get when you're talking about a chronic pain issue. Now, my patients who have high blood pressure, the tincture and the gummy together are perfect. Twice a day, every day, for the best results. Now, we also have a wide assortment of other smokables, like the pre-roll and the vapes. Again, smokables will take a simple 1 minute duration onset to get into your system and start to give you the relief that you're needing. So we do have other forms of the smokable. We have a wide variety of different gummies that you can use as well for many different reasons. First up, we have the King of the Jungle. I do like to say it could be called the Queen of the Jungle as well. This is helping our libido and our stamina. This is something that can be safely used. It's our main player in our sexual wellness line. This is a safer alternative than Levitra or Cialis or Viagra. At least with this, I don't have to worry about blood pressure dropping too low or the heart stopping. Because, people would like to have that intimacy without worrying about having a heart attack, right? Well, on a side for women, we have nothing. There's not anything really out there that women can take to boost their libido and their stamina. But the King of the Jungle, or like I said, can be also called the Queen of the Jungle, can actually give them that enhancement that they're looking for. Now, the next one up is the Flight Delta 8, the caution sign over there, because it is the closest thing that we have to the real deal. So if you've had trouble with marijuana in general, then you want to steer clear of this. But if you have not, this product has been used, and it helps with those creative juices. It helps to get those wheels flowing and moving. It helps people. I've had patients tell me, I have projects that have been sitting there forever that I'm finally completing, and new projects that they're starting and also completing. So it gets those creative juices moving. But for me, it is also, in my opinion, going to be a great alternative to the opioid epidemic. This is something that I've used, and I have successfully been able to get people off of opioids. Why? This is offering them pain relief, but it's also offering them a relief of inflammation throughout the body. So they're sleeping better. They feel more energetic. They are more focused. Their anxiety is less. So we're talking about CBD because our endocannabinoid system is going to allow that CBD to get in the body and search around to see exactly where it's needed from head to toe. And once it's in the body and it binds in those different areas where it's really needed, and you have relief throughout the body, that makes more sense. And they feel better and they want to continue to do better. That is how we beat the opioid epidemic. So again, this is the rising star, and I can't wait to see what's happening in the near future, because I know that this is going to be a takeover when it comes to CBD. We have the pure gummies. Now, we have two different lines. We have a power line and we have a pure line when it comes to our CBD products. The pure line is for those who have to do drug testing for their employer. All of our products are made within the federal regulations. They are not, there's nothing with our products that is not within the federal regulations. However, every employer is different, and every employer has the right to make whatever rules they want. So for people who are working offshore, for people who are in healthcare, for people who are teachers, you may still be subjected to drug testing. And if you are, the federal limit of THC that can be in all CBD products is 0.3%. Even though it sounds like a little bitty percent, the potential for it to build in the body and cause you to have a positive drug test is there. So if you have to do drug testing, Wakana wanted to make sure that we had products for you as well. So with our pure products, as much of the THC as possible has been extracted out so that you can safely take our CBD products, get the symptom relief you're looking for, and still pass your drug test. And then here we have our Power Gummy again, which we talked about already. There is a variety of culinary products. We have 3 different amazing seasonings: garlic fire, flavor king, and the chili lime, the CBD butter. And we also have some infusion oils that you can add to your. We have the King T'Chaga, which is our only capsule. And this is CBD that has been combined with the chaga mushroom, but we're talking about anti-inflammatory properties, anti-tumor properties, antibacterial, boosts the immune system, and it can also help with the cholesterol and your blood sugar. We have a variety of different essential oils, which it's another rising star just in general in our populations. But that black seed oil is something that if you've never really heard of it, you really need to get to know more about that black seed oil. So many wonderful health properties, but used in hospitals now because it has antibacterial, antiviral, and antifungal properties. But that black seed oil actually also helps to upregulate beta cells in the pancreas and can help with your natural ability to produce insulin and lower your blood sugar. We have a line of sexual wellness products. Again, there's the King of the Jungle, but there's also a G-Spot lube, a Cherry Bliss lube, and body butter. What's not shown here is also we have a good CBD massage oil now as well. We have our healthy hair line, and it is phenomenal. I love this line. Why? Because my hair had gotten to be so thin and brittle. I had lost my hair all across the front, and this hemp power hair really, really brought back my crown of glory. First off, we're talking about the Power Hemp Powered Hair, and you can take these and you could use them under the tongue, but how I've always used it is actually putting it on the scalp in the areas where my hair had been thinner, rubbing it in so that it can help the follicles right at the spot where it's thinning, relieving inflammation in the follicles so that it could grow longer, stronger, healthier hair. And for men who are looking for something to help with their beard so they can have a fuller beard, a healthier beard, we have the beard and scalp oil. Well, when you combine these things with the phenomenal SOS hair care system, the Save Our Strands hair care system, you cannot ask for a better hair care line. I promise you. You will not be disappointed. You get the shampoo, the conditioner, and the leave-in detangler, which are the main products. And if you want after, you can use the styling cream and this oud body oil, which will give a nice shine to your hair. But this oud body oil actually can be placed on your body, on your skin, and it helps with the rough skin areas, eczema areas, the heel of your feet. I've actually had several of our business partners tell me that when they had some severe itching from eczema or even poison ivy, that putting that on actually helped. So a lot of different health benefits, a lot of different symptom benefits, but the main reason we have the system is because it allows us to grow our crown of glory back and give us longer, stronger, healthier hair. And last but not least, we have our absolutely phenomenal Flat Belly Lifestyle 2.0 program. This program is changing lives. This program involves using the eliminator, which is getting rid of mucus and parasites in your body, in your GI tract, the purifier, which is getting rid of toxins, and the regenerator, which is giving us all the essential superfood nutrients we need for healthier cells, to reverse inflammation in our GI tract, which in turn is going to give us a healthier immune system, boost our metabolism, and reduce inflammation in the body. This program is literally reversing disease processes in the body. You're going to get some absolutely wonderful weight loss, because who doesn't want to lose weight? But the weight loss is one of those side benefits. The real benefit is that you're reducing inflammation in your body. You are reversing aging. You are setting yourself up for that better quality of life that I talked about earlier, because again, you may live to be 80 or 90 years old, but how will you be living? The Flat Belly Lifestyle Program is allowing us to reverse aging. The first thing patients recognized when I did this program was that my face just looked so much lighter, and they kept saying, you look like you're glowing, you look like you're glowing. And it is the first thing that they realized, because you know, our skin is going to tell it all, right? The face, our hands. But again, that's because our cells have gotten to be so sluggish. If you're not sleeping enough, the cell repair is not happening. You have a very, very acidic pH environment in your body that is high in inflammation. And when you do this program, you're reversing those things. You're improving the pH. You're getting a more normal or a little alkaline pH environment that brings the inflammation down. And guess what that means? Disease has a rough time thriving in an environment where there's not a lot of inflammation and where the pH is not acidic. So you are improving the health of your cells, the health of your organs. You are reversing aging. And not that you're just reversing, you will feel the difference. You're going to have more energy. You're going to feel great, and you're going to lose weight. And so that combination is just an amazing combination. I mean, look at our phenomenal Chief Sales Officer, Ms. Phyllis Nash. Now, Ms. Phyllis, I like to say Ms. Phyllis was already fine. Now she fine. But Miss Phyllis, I can't even lie. I don't want to say how old Miss Phyllis is. I believe she's up there, but you can't tell. Look at that. You cannot tell at all, because she has taken the pledge and she has committed herself to living a healthier life. I did this back in January, and after gaining 50 pounds after a tragedy, I got those 50 pounds off. And I haven't gained the weight back. All I've been doing now is actually just eating from my blood type. And I am literally, I'm really, really considering doing a slow transition to being just completely raw. Now, I don't know how long it's going to take me to get to the completely raw, but I can tell you this, that I'm definitely sticking with eating from my blood type. And I have given up meat completely, not cooked foods, but I've given up meats, all meats except my, crawfish. I'm a Louisiana girl. I need my crawfish right now, but that might change in the future. However, I haven't gained my weight back. I still have a lot of energy. I still feel wonderful. That is what I realized after I had done that program the first week. And my intention was only 1 week to do that program because I didn't think I could go 3 weeks without eating meat. But after 1 week of doing this program and feeling energy that I had not felt in I don't know how long, I couldn't give up that good feeling. And that's how I ended up staying on the program. So I challenge all of you, give it a try. You will not regret it. Do not focus on, oh my goodness, I don't know if I can give up meat. Don't focus on, I know I have it in me to do it for 1 week. Because that's what I said. I knew I had it in me that I could do it for at least 1 week. Give it a try for at least 1 week and see how far you go, because you're going to feel phenomenal. So that concludes our presentation tonight. And I'm going to see what kind of questions you all have. What is the link to get sodium number? It is actually all you have to do, Ma Mitchell, is type in Nutritional Facts for and put in the name of the restaurant. Hopefully you can see this. Nutritional Facts for, and you just fill in the blank. Wendy's, Popeyes, Chili's, Zia's, Papados, whatever restaurant you want. If you put in the name of the restaurant, it'll pull up the actual menu. Like, I don't know how many of you eat at Zia's. I don't know how far out Zia's goes, but I had a patient once who came in and in one night she gained 7 pounds. So we're going through, okay, what exactly did you eat? And she said, well, she knew she was going to Zia's the night before. So she said, I didn't have a lot at all. She said that morning she had a banana. For lunch, she had a salad, and the salad was only veggies, nothing, no extra anything. And then she went to Zia's and she had some ribs and she had 2 servings of corn grits. Well, we pulled up Nutritional Facts for Zia's. 1 scoop of corn grits was 2,100 milligrams of sodium. 1 scoop. So she had 2 scoops. So she had 4,200 milligrams of sodium just with the corn grits. That didn't even count the ribs. It didn't count her drink. It didn't count her dessert. So by the time she went home, she had well over 5,000 milligrams of sodium. So it's very important for you to pay attention to the sodium content of your food. Read every label, and not just reading the label, but you need to read the label and you need to pay attention to the serving size. Crackers, for example, it might tell you that the serving size, that the sodium content is about 300 milligrams, but the serving size is going to be 5 crackers. So 5 crackers has 300 milligrams of sodium. So if you have 15, that's 5 times 3. So now you have to do the 300 times 3. That's 900 milligrams of sodium. And if you're eating out, definitely you want to make sure that you pull up those nutritional facts. It's so many hidden places. It's so many things that you would not think that the sodium is high. And once you pull it up, you'd be surprised. Like a small fry is almost 1,000. 1 breakfast meal at McDonald's or Burger King is over 2,000. So if you have those breakfast meals, you already have eaten up pretty much your total sodium for the day. So you just want to pay attention to that. So again, sleep apnea is a big deal. It can lead to sudden death. It can lead to early heart attacks and strokes. The youngest patient I had was a 23-year-old who had a stroke. He was driving truck. This guy woke up, drove his truck to the truck stop, and when he got out of his truck, he could not move one side of his body. That's right. Because the thing that I find with sleep apnea, when you have an event as a result of heart attack or stroke, there is no warning. It just happens, which is another scary thing. So any other questions? Any other questions? How can my husband get an AutoPAP machine? VA does not offer this. Actually, you know what, my Mitchell? I treat a lot of vets. And they have the ability to get CPAP machines for them. If the VA itself doesn't have it, then his doctor has the ability to refer him to a pulmonologist or an internist who can get the CPAP for him. Now, you can go on Amazon and buy a CPAP machine or an AutoPAP. If you're buying it outright, you need an AutoPAP, so that, the pressure is already set and it can give you whatever you need. But if he has not had a sleep study, then he needs to have a sleep study done first to see if he has sleep apnea or not. And once he has a true diagnosis, then he can go on ahead and get that CPAP. He has a CPAP. Oh, the AutoPAP. I'm so sorry. I'm so sorry. So, it's you're right about that. Every vet that I have, they only offer them the CPAP. Those who have the AutoPAP had to use their private insurance. So if he only has like the VA option, then the only other option, unfortunately, would be you going on Amazon or on one of the durable medical equipment sites and buying an AutoPAP. Yes, ma'am. Sorry, I misunderstood that question. All right. Any other? You're welcome. You're very welcome. But the AutoPAP is better. He doesn't have to go. With the AutoPAP, you're supposed to go back every year to the sleep lab and get that pressure rechecked. And I know most doctors don't do that, but you're supposed to go and get it checked every single year to make sure that it's still the right pressure, because, weight changes. All right. Any other questions? Thank you so much for hanging in there with me. I hope and pray that this was some, interesting information for you. I pray that you are all blessed this evening. And if there are no other questions, I am going to bid you all good night. Bye all. Y'all have a wonderful night, and thank you for your time and your attention. Good night.